Hello, my name's Jeff, and I'm here to talk about the four types of shock. One being cardiogenic shock, two being distributive shock, three being septic shock, and the fourth one being obstructive shock. But we're going to focus more on cardiac tamponade for that one. So first off, cardiogenic shock is from decreased cardiac output, evidence of tissue which is an evidence of tissue hypoxemia in the presence of adequate intravascular volume. Cardiogenic shock is the leading cause of death in acute myocardial infarctions, or in this case, heart attacks, with a mortality rate as high as 70 to 90% without aggressive experienced care. The incident rate of cardiogenic shock ranges from either from 5 to 10% in patients with acute myocardial infarctions. So the second one we'll talk about is distributive shock, which results from excessive vasodilation and the impaired distribution of blood flow. Septic shock is the most common form of this distributive shock and is characterized by considerable mortality, treated around 30% and untreated greater than 80%. In the U.S., this is the leading cause of non-cardiac deaths in the ICU. It develops in more than 750,000 or 250,000 people per year in the U.S. Thirdly, septic shock. Serious medical condition that occurs with sepsis, which is an organ issue, injury, or damage in response to an infection. This leads to dangerously low blood pressure and abnormalities in cellular metabolism. Septic shock occurs in patients with sepsis and an underlying circulatory and cellular metabolic abnormality associated with an increased mortality. This can be defined by persisting hypotension requiring vasopressors to maintain a mean arterial pressure of 65 torr or higher than a serum lactate level greater than 2 millimoles per liter, despite adequate volume resuscitation. There is reported 3 cases per 1,000 people of severe sepsis and 2.26 cases per 100 person or hospitalized discharges. Most elderly and those being exposed to invasive procedures have the greatest risk for septic shock. Cardiac tamponade or obstructive shock, the last one, is a syndrome caused by an accumulation of fluid in the pericardial space. It's resulting in reduced ventricular filling and subsequent hemodynamic compromise. It's a medical emergency with complications including pulmonary edema, shock, and death. The incidence of cardiac tamponade is 2 cases per 10,000 people in the U.S. Approximately 2% of penetrating injuries are reported to result in cardiac tamponade.